Thank you, first of all, so much for doing this. I've been thinking of reaching out to you since the beginning of the year, but I imagine that you were a little bit too busy saving lives, as you probably still are. But I do appreciate the time that you're taking. I mean, I don't know how busy you are. I don't know what your schedule is normally like, but I can only assume that since March, you've probably lost whatever was left of your life. So.
Yeah. I mean, I was lucky. By the way, thank you very much for the invite. I came back from winter vacation at the end of February, early March, and I knew things were not looking good since January because, of course, I'm an infectious diseases specialist, and this is my specialty. And this all this all started to look really bad. Reminded me of SARS. Almost 15 years ago, not really, but maybe 12 years ago, how long ago it was in 2003. And I knew what was coming. I knew that the lockdown was coming. I knew that this was going to be because I get insider information before other people do.
Right.
But I was lucky because as soon as I came back, I had to teach McGill because I teach infectious diseases at McGill, the first year class. So my schedule was open because I don't do clinical work when I'm teaching. I go to the university. Okay. And of course, everything was online. So I had to scramble last minute to make my whole course online.
Yeah. Wow.
Thank goodness for pre-taped classes. But then what that opened up to me being available to cover colleagues who are either quarantining or sick or whatever. So yeah, it's been a little bit crazy.
Yeah.
And as we speak right now, I'm currently, on the COVID floor. So I am running back and forth from the floor to the office.
Tell me before we get started, first of all, how are you? How is your family? I know you have kids. How is it, coping during this whole time?
It's not easy because it's not easy for my wife. She's the real hero here because, you've got two toddlers, now they're under 3, but 2 under 3, where it was 2 under 2 when all of this started, where she suddenly has to deal with both of them at home instead of one at daycare and,
Right.
baby. And, she can't leave the house, only to do groceries. We're not allowed seeing any. We don't have the support, grandparents, babysitting, this, that. So even when I work long hours, I come home. At least when I go away, at least I change my mind, my mentality, even though it's in the hospital. But it's her that had to deal with this. So,
Right.
Hats off to my wife. The kids are fine. The kids don't understand.
They don't really understand.
They're just driving us crazy, regardless of whether one goes to daycare or not. One of them is back in daycare since July, though.
Okay. Tell everyone listening or watching, what it is that you are specialized in, where you work, just so we can get a good idea.
Yeah. So I'm a pediatrician by training. Before becoming a pediatrician, I had a degree in microbiology and immunology, Bachelor of Science in McGill, with some research background there. And pediatrics, infectious diseases, so a subspecialist in because pediatrics is a specialty in and of itself, subspecialty infectious diseases, super specialty pediatric HIV. So that's my
so this pandemic is somewhat, kind of down your alley.
Oh, totally.
Yeah.
Totally. This is my specialty. This is my raison d'être.
So let me ask you something, because, we see this thing breaking out in China late last year. You said that you were pretty much getting ready in January. Obviously, were you expecting this at all to make it all the way here? I mean, was there any precautionary preparation happening at that time in the hospitals?
Oh, my. Yes. I was expecting it. To be honest, a lot of us were. Here's the deal. Whatever happens in China, the information that was trickling out of China may not have been fully disclosed in the beginning. Even colleagues and people around the globe that do my job were kind of like, this is going to be like the flu. This is not going to be very serious, et cetera, et cetera. And then Iran and Italy happened. And that's when everybody was, this is, no, this is not good,
Yeah.
I tended to be a little bit more cautious, and I was saying we need to prepare. And so we were preparing, but we weren't expecting it to be so bad. And we, unfortunately, the Western world was hit like a tidal wave. Yet we were scrambling, and we were able to lock down and prepare the hospital as quickly as possible. And we did. And I think that the first wave saved us a little bit here. Our preparation, no matter how short it was prior to it, we prepared adequately enough where we opened up beds. We created whole COVID floors with negative pressure rooms that weren't there before in record time. And that is a testament to the professionalism and to the hard work ethic that my colleagues have,
Do you think are hospitals better equipped or better prepared now? I mean, can they manage the capacity better if ever things get really out of hand?
Yes, I think so. There's getting really out of hand, and then there's getting really, really out of hand. I think that we're not, overall getting really, really out of hand where we go over the limit of our ICU beds. I don't think the country is prepared for this, we haven't built 2 1,000-bed hospitals in 2 weeks the way China did.
Yeah.
What we did is we increased our capacity in terms of the types of rooms that we have, the types of ICU beds that we have. We just didn't build hospitals. And, the important thing for that first wave was not to stop it from coming, but to sort of flatten it a little bit where the demand for healthcare is below the number of ICU beds and the number of ventilators that we have.
So what's the capacity right now? Are you only working in the children's hospital, or are you like in the whole mega hospital?
No, I only work at the children's hospital. I don't have, I'm not an adult physician.
Yeah.
Even though I can take care of adults, I'm not an adult physician. And
so what's the capacity there for the children?
Right now we're fine. I don't have the numbers per se. We're okay. The first wave saw, the Jewish General Hospital was the one that was the main hospital on the McGill side. And I think it was Maisonneuve-Rosemont, that was the hospital on the Francophone side, on the Université de Montréal, and Saint-Justin from the children's, from the pediatric side. We were sort of delegated as the spillover.
Yeah.
And, at one point, there were 20-something people in the ICU here with, they had to open up a whole new section. And all that section was filled up with patients with COVID-19 who were intubated. The Jewish was practically over capacity.
I was thinking about this, and
they even spilled over to the children's. I'm sorry to interrupt. Maybe people don't realize this, but we also hosted adults in the ICU and on our wards.
Yeah, that's what I was going to say. I mean, it must be this logistical puzzle. I mean, you're dealing with children that they're probably suffering from other things other than COVID-19, right? And then you have to assume this whole responsibility, make sure that, none of this disease kind of spills over into the other sections of the children, that you want to protect the other kids as well. I mean, it must be like this enormous headache.
My infection control colleagues, congratulations to them, because I wouldn't be able to do the job that they do. To the point of burnout, where they would answer like 300 calls a day, 300 emails a day, be here until 10 p.m. at night, preparing the hospital and preparing the protocols, what personal protective equipment, and then we have the shortage of the personal protective equipment in the beginning. What to do, scrambling to find the literature, looking to see if we can reuse and what materials can we reuse and what masks can we sterilize safely and all this kind of business. Right now we are in a better position, but we are my fear is we are looking at a larger wave than the first one.
Wow. So what exactly did we know then when it started, and what do we know now about the virus?
Well, right now we know that the virus is not as deadly as SARS-1 and not as deadly as MERS coronavirus. We know, though, that it is about 5 times, maybe 10 times deadlier than the common flu. We know that, and those numbers are still being looked at.
Yeah.
But to me, the crude mortality rate doesn't matter. What I see in the hospitals is not the flu. I've never had, colleagues, because we can talk about how children have fared much better. Like our ICU was practically empty. We didn't see kids coming in with COVID-19 the way adults did and had to spill over into the children's side because we had room. Mm-hmm. Obviously, it doesn't attack children with such a vengeance as it does adults. Not to say that it has not caused problems for many children. In fact, right now, I'm on the quote-unquote COVID floor at the Children's Hospital, and we are dealing with 2 or 3 children who have this strange Kawasaki-like illness, and they're quite sick. They had COVID, and 6 weeks later, they come in quite sick. So not that it hasn't affected children, but what we found out that it doesn't affect children as badly as the flu does, that it is deadlier than the flu. It is more infectious and easily, very easily transmittable because our population has never seen this type of virus before. So we don't have, prior immunity to other, coronaviruses that are very similar to this one, the way we do the flu, where it's just one little mutation per year. And then you have a pandemic that nobody has immunity to, but we haven't had that since 2009. But you have these little mutations from year to year that confers some form of immunity in the population as a whole, some herd immunity in the population as a whole that doesn't cause these huge rapid waves and infectious transmissions the way this does. We know that it is a very bizarre virus that doesn't only affect the lungs, that causes multiple problems in multiple systems, including blood clots and strokes, apart from the pneumonia that can kill you. Blood clots and strokes and lung clots and renal failure and this strange post-immune attack like Kawasaki, like multi-system inflammatory disease that is seen in kids and now even described in adults. The CDC just came out with a report of a few adults being affected with this. And then there's all these people who are what's called the long haulers, where they've come over all of this, and then they have for months later, exercise intolerance and not being able to think properly and being confused and brain fog, lung issues, this cough that they can't catch their breath. Mm-hmm. We're seeing this.
Wow. There were some theories a few weeks ago that this virus may very well be airborne. Is that true? I mean, is anyone looking into that? Or?
Yeah. So the virus is primarily spread like other respiratory viruses, like the flu, through, big saliva droplets, mucus droplets, close contact, because when we talk, we spit, it flies onto people. The other way this virus spreads is through contact. So if we sneeze on our hands, or if we cough, or if we pick our noses or whatever, and then we touch somebody, yes, or we touch a doorknob, and then immediately somebody else touches it and then touch their face. So contact droplet is the way it is. Through fomites, as we call it, meaning through inanimate objects, like I touch this, or I even, touch the handle. It's not the primary way, because most of us are washing hands and, not touching our faces. And so the transmission is not easily done through inanimate objects. Everyone's talking about Halloween coming up in a few days. I don't think it's a big deal if people are careful and they wash their hands and they use tongs to, you don't need to wash your groceries or wash everything again. To be safe, if you want to keep inanimate things 24 hours, without touching them, that's fine. Nobody is telling you not to do that. But in terms of airborne that you were telling me about, so there are some procedures that can happen that promote airborne spread. Classic airborne viruses that are transmitted are chickenpox, measles, and bacteria like tuberculosis. Those are carried by air currents to long distances. They are sturdier viruses, and they can infect people. Like, you've got somebody who's coughing, and somebody down the hallway can be infected with what you have.
All right.
COVID is really not that, or SARS-2 coronavirus is really not that easily transmitted that way. There are instances where an aerosol can be formed. An aerosol is smaller than a droplet. So the aerosol will come out of our mouths or our noses, and it'll evaporate. The water will evaporate, and the virus will be naked. Once that virus is naked, then it can linger in the air. Eventually, it's going to fall down. Mm-hmm. Or eventually, the UV light or the extreme temperatures will kill it and will not be easily transmissible like other airborne viruses. But if somebody is intubated and they are being suctioned, or if they're forcefully coughing or forcefully sneezing, then yeah, the potential for aerosolization is there. Somebody who goes to the dentist and gets drilling done, that sound, that potentially can aerosolize the virus. If somebody is screaming or singing loudly, like in a choir, and they are in a closed space, then, and if somebody is close to them in that closed space without wearing any personal protective equipment, then yes, the transmission can occur, but this happens rarely.
Right. I want to get back to what you're saying about the children and how so far they haven't been considered, a really significant, transmissible agent. But, of course, we've seen that, the positive cases in that age group were, almost negligible. Is that still true today? Because as soon as the schools started opening back in August, September, cases started rising in the schools. And I think we saw close to like 200 schools closing. Should parents be worried about sending their kids to school? What's going on in that age group now? Has anything changed from the beginning?
Yeah, so I think that children brought it into the school. Teachers brought it into the school. There hasn't been this impression that kids are infecting each other horizontally at a big level, although perhaps they are. Looking at countries that didn't close schools or that opened schools sooner than we did, there have been some kids that have transmitted, but it doesn't seem to be, which is interesting, it doesn't seem to be that children are the main vectors of transmission of this, or the pushers of this pandemic. We know that 40 to 50% of people who are just about to become sick, so they're pre-symptomatic, they don't have symptoms yet, but they have a very high, they're shedding the virus, very high viral load in their upper airways and in their nose. They're the ones that are pushing the transmission without knowing. Once you're sick, you're at home and you're, separated from everybody. But it's the people who don't realize that they are incubating the virus and they're about to become sick, in those few hours right before they become sick, they're transmitting. They're going around, I don't know, right? Talking loudly, picking their noses or whatever, kissing other people, sharing things. And that's how the transmission has happened. And we saw it when we opened up our economy and the bars opened up and, restaurants opened up and people were congregating together. You all saw what happened at the White House,
right?
At the Rose Garden, or that super spreader event. Even though I was outside, and I can't believe that Vice President Pence saying, "Oh, experts are telling us it's outside, it's safe." Dude, you're the coronavirus task force leader. You don't realize that yes, outside is safe, but not outside on top of each other.
Right.
So children, maybe because they're small, and they can't give to an adult as easily because they're not screaming and yelling at, who knows? Or the fact that they don't carry such, they have less receptors in their for the virus in their upper airway. It remains to be seen, but there are some very interesting epidemiological studies from across the world that showed that children are not the main vectors of transmission, and it's mostly the teenagers and older adults. Right. Teenagers can transmit as easily as older adults. But, but for parents, even if your child does get it, most chances are that they're going to be one of these asymptomatic cases.
Right. Look, I don't want to get you to comment anything, happening politically, but I'm sure like anyone else, you're probably following, what the different health professionals are saying, whether it's our own health directors here in Canada or across the other provinces or, even throughout the world. It seems as though there's been, a difference in opinion and approaches, and not only in Canada, not only within Canada, but, also across the world. I mean, there have been recommendations by the World Health Organization that haven't been applied here, but were applied in Europe. I'm thinking, for example, the wearing of the mask, which came here relatively late compared to some countries in Europe. Why, is there a reason for this discrepancy? I mean, what's the issue there?
Well, I think that, without making a political statement, there are countries in this world or leaders in this world that really want this thing to go away and want their economy to be strong, because obviously if we close down everything, the economy collapses, and it has. You can see that it has. There is a fine balance as a politician to say it like it is and maybe sugarcoat it a little bit to try to find this balance to maintain public health and maintain the economy. So you give a little, you take a little, you give a little, you take a little. And sometimes because of this, there's this dichotomy that the messages have gotten scrambled and have been confusing for the public.
Right.
I don't know why the WHO, I'm not sure what you meant about the masks, because in Asia, societies, even before.
Yeah, they always wore masks.
They always wore masks.
I'm thinking, for example, countries like in Greece, Italy, even France and Spain, they automatically adopted the policy of wearing masks in public. And over here, it came really, much later.
So wearing masks, so let's say about wearing masks in school. Greece has mandated that everybody above 5 years of age, 6 years of age, I can't remember, has to wear a mask in school at all times.
Yeah.
I really don't understand why we are not mandating masks in schools 5 or 6 years and older. Of course, you're going to tell me, but you're just telling me that kids aren't the ones that are pushing this pandemic. Yeah, but why not err on the side of caution? The data is still trickling in. What we know now, we didn't know, a month or 2 or 3 ago, and I think that we've been humbled multiple times. And as you saw, we pressured the government, and they kind of caved and said, okay, high school students have to wear this because they know that teenagers are the ones that transmit more. But my suggestion is, why not everybody above 5 or 6 years of age, if you're congregating inside a class, and your teachers and everybody, wear a mask.
Yeah.
This is why masks are needed, because this piece of fabric, if you put it over your face, you're trapping, even though you've got holes here, even though you've got holes here, even though it's not an N95 mask, I'm talking, and everything is being trapped on the inside. Even if a little bit goes out, the amount that is infectious is much, much smaller than if I do this and I'm screaming and yelling.
Right.
So the mask is not to protect us, which was the wrong thinking in the beginning, because we obviously also needed to preserve this for the healthcare workers. This is to protect others from you, because you don't know when you're going to fall sick.
Right.
And, and I think that why Europe has done it, I can only speculate that it is a political decision. Perhaps some countries whose economy is much more fragile require more draconian measures. You saw Greece, one of the first countries to lock it down completely.
Yeah.
And you saw their wave went like this.
Yeah, it barely affected them.
Compared to other countries that went like this.
Yeah. Look, the cases here in Quebec, they're on the rise again. I mean, I think we're well over 1,000 a day.
Yes.
And I can't remember exactly, but I think that this time around, back in April, we were completely in lockdown.
Yes.
And like you said, I mean, obviously there's a fine line between, collapsing completely your economy and seeing if you can kind of control the situation a little bit. But do you think we're making the right decision here? Are we being less careful than we were back in March or April?
Nobody likes lockdowns. Okay, they're not good for the economy. They're not good for, and what's not good for the economy is not good for people's jobs, people's well-being, people's psyche. Unfortunately, this pandemic has uncovered a lot of psychopathology in our society, where people, rightfully so, became depressed, and people, perhaps not rightfully so, veered toward the conspiracy route, saying that this is all fake, world domination, etc., whatever you want to call it. And of course, certain politicians have abused that for their advantage. I think a lockdown is necessary if you are about to see a tidal wave, if you are foreseeing that what's going to happen is going to overwhelm your healthcare system. And what is worse for the economy than a lockdown is people overwhelming the healthcare system and collapsing it to the point where people can't go to work, people have to quarantine. You're going to lock down regardless.
Yeah, and you're foreseeing this wave coming. You think it's going to be way bigger than the first time?
It already is.
Yeah.
Not in deaths yet.
Yeah.
Because the deaths always lag 2 to 4 weeks afterwards, after the cases start. It's about the 8th day, 5 to 8 days when people start getting really sick and requiring hospital care. And by the 10th day is when people who require to be needing ICU care go to the ICU. And, we can talk about Sweden. I think their approach is wrong. Mm-hmm. Sure, their economy shrank. Don't let anybody tell you that their economy didn't shrink. In the second quarter of 2020, their economy shrank 8%, just 7%, sorry, just a little bit less than 8.3% of the United States economy. They all shrank. Mm-hmm. Now, their economy is starting to go up again, but their unemployment is still at 15, 20%. Sure, they might bounce back faster, but we are such an interconnected world that Sweden is not an island, and their economy is still going to be bad after all of this. But what they did sacrifice is lives.
Right.
Their per capita death rate per million people is astronomically higher, and it's in the top 10 of the world. It's almost up there with the United States. It's almost up there with Belgium and Italy, who got slammed in the beginning. So, do I like lockdowns? No. How can we avoid a lockdown? Wear a mask. Yeah. Wash your hands. You want the economy to open? You do that.
I want to go back to what you're saying about people comparing it to the flu. And like you said, we were quick to jump into this conspiracy theorist attitude, which happens, I think, with pretty much anything. It was almost to be expected. But, people comparing this to the flu or to other seasonal viruses, unfortunately, they take a similar portion of lives every year, if not possibly less. In this, it's maybe a little bit more. But as a doctor, what's your reaction to this? Why, if at all, is this different, and why should we be more cautious?
Because it's not the flu. I'm sorry, I was looking down because I was being texted by my resident from the floor. Because it's not the flu.
Yeah.
It isn't. The flu has not taken up, at any season, the flu has not taken up all of the ICU beds in an adult hospital. Ever.
Yeah.
Even in the 2009 swine flu pandemic, which turned out to be more of a dud because it wasn't very deadly. It was like 0.1, 0.2% mortality rate. But a lot of people did get sick because a lot of people got infected. Mm-hmm. And so there were a number of deaths in 2009. Looking at the excess mortality overall excess mortality, and it's like astronomical in 2020 compared to 2019.
Right.
You can't, and then you have all these long haulers that can't get back to what they used to do before.
Right.
So, it's not like, oh, you got a cold and it's gone. No, you got the flu, it's gone. And most of the times. Sometimes it leaves you with some after effects like, heart and lung.
Right.
But this one here seems to be, even young people seem to have heart damage, lung damage, brain damage that is long lasting, and they're debilitated.
Right. I know you got to go back to work. One last question. Is there a realistic timeline for a vaccine or maybe even a cure? I mean, how hopeful are you that we're, about returning back to normalcy sooner rather than later?
So I have to say it like it is. I can't, I'm a scientist, I'm a physician. I don't think we're going to be back to normal before the summer of this year. I think we will be wearing masks for a few more months and way past into the summer, because even if the vaccine comes out, by the way, I'm touching my face and stuff, but don't worry, I washed my hands before coming into my office.
You're not next to me, so I'm not worried.
Nobody around here, and there's no COVID on this hand. But I have to say, though, we got to intersperse it with some humor once in a while.
Sure, yeah.
I have to say, though, that the phase 3 trials are looking promising. Yes, you hear in the news, so-and-so got sick. One person died, maybe, perhaps in Brazil. Maybe that person was on the placebo, maybe not. The data is still being looked at. But we are, and whether it is because of the vaccine or whether it's because there is a, by chance. Because if you follow 30,000 people, 1 or 2 people might get sick with something else. And then just because they got the vaccine, is it because of the vaccine or is it because of something else?
Right.
So, I think we have to, it's like saying, you're being followed in a trial, you get the vaccine and then you get lung cancer, but you're a smoker. So is it because you got lung cancer because you got the vaccine, or is it because you got it because you were smoking? Yeah. So all of these have to be looked at. These are crude examples that I'm giving you. But the phase 3 trials look very promising for a couple of the, vaccines that are out there already. And I was listening to Dr. Fauci, Anthony Fauci of the United States, yesterday on a conference call. And he was saying that we're looking at optimistically cautious, looking at sometime end of November, early December, where they might ask for emergency authorization from the United States, from the FDA. It doesn't mean that the vaccine is going to be ready, because you have to mass produce it, you have to give it, and you're still following up these patients, these volunteers that got it. In fact, what they need to do is they need to see now, of those volunteers, they need to see how many of these get infected with COVID and how many of these don't end up getting sick. So far, the antibodies are there. The immunity is there. That's what's promising. But does it work? So we have to see, now that wave is like this in the United States, I'm sure people are going to be infected, and these volunteers are going to be out in society not wearing masks on purpose.
Right.
And so they have to see how they respond and how they fare. I think they're going to get the data, and, we're being cautiously optimistic, but they have to mass produce it and then give it out to people.
What about here in Canada? What's happening here in Canada?
We're kind of parallel with whatever's happening in the United States.
I'm going to let you go.
I think the vaccine is going to be available sometime in early to mid 2021. We are still going to be wearing masks. You need about 60 to 70% herd immunity for this virus in order for the curve to go flat. And, either that's going to be with a lot of deaths because a lot of people getting sick. That's the herd immunity model, the natural herd immunity model, or it's going to be through a vaccine, which is what I hope and what many people hope.
Right. Thank you for your time. I'm going to let you get back to work. I really appreciate it. And honestly, I think I speak for everyone when I say thank you for everything that you're doing and for literally putting yourself in harm's way to keep us safe. Hopefully everything will be well for you and for your colleagues and for all of us, basically.
Thank you very much for the opportunity to speak. And I can always come back and give you an update in the future.
Absolutely. Looking forward to that one.
Thank you.
Thank you. Ciao.
Have a good day.